Hi, my name is Jennifer Pierre. I'm a Maryville nurse practitioner student, and I'm going to be doing my neurological assessment today. This is my ID. Okay, and we're just going to do a quick 360 of the room. All right, and this is my patient today. The first thing that we're going to do is assess the cranial nerves. The first one is going to be the olfactory nerve. With the olfactory nerve, basically we're just assessing the patient's sense of smell by occluding each nair and having them smell certain. Stop moving back and forth, and having them differentiate between certain smells. The next one is going to be the cranial nerve number 2, which is the optic nerve, and with that nerve we'll have them read from the Snellen chart and cover each eye and read the line from the Snellen chart, and we're also going to take a look at their optic disc with the ophthalmoscope. Okay, so I'm going to do that. Okay. All right. And with that, we're just looking at the optic disc and the fundus, making sure everything looks good with that. The cranial nerve number 3, 4, and 6. That's going to be the oculomotor, the trochlear, and the abducens. And with that, we're just going to look for any eye drooping or anything like that. We're also going to be looking at making sure that the pupils are nice and equal. We're going to look for the pupil's reaction to light. If you could just look forward for me. Okay, and we're also looking for accommodation as well as consensual response with that. Oops. All right, next we're going to be looking at the trigeminal nerve, which is cranial nerve number 5. With cranial nerve number 5, we're going to be looking for atrophy in the face and make sure there's no facial drooping or anything like that. I'm also going to touch the back of your jaw here. I'm going to actually clench your teeth. Okay, and we're going to check for, with that, we're checking for muscle tone. Also with cranial nerve number 5, we're going to also assess their sense of touch on their face with touching with something soft and something sharp on their chin and their cheek and their scalp area. And just because of time constraint and demonstration purposes, we're not going to do that right now. But ordinarily we would get something soft and sharp to test that. Cranial nerve number 7 is the facial nerve, and we're going to ask the patient to smile and frown and then puff their cheeks out like a blowfish. Okay, and we're looking for, you can stop, and we're looking for symmetry with that. Okay, anything asymmetrical would be abnormal. Cranial nerve number 8 is the acoustic nerve, and with that nerve we're basically going to test that with the Rene test and the Weber test. And with the Weber test, I'm just going to put this up, the tuning fork on the top of the head, and ask the patient where they hear the sound. Both ears or one ear?
No.
Okay. So the Rene test is on the mastoid bone behind the ear. And that is, just let me know when you stop hearing the sound.
Okay. Okay.
All right, and that's the Rene test. Is normal to for air conduction to be longer than the bone conduction. The next nerve, the cranial nerve number 9, is going to be the glossopharyngeal, and that's where we test the sense of taste with the sour and sweet taste. And because, like I said, it's time constraint and demonstration purposes, we are not going to do that. But you would take the sour and sweet taste and place it on the tongue and have the patient differentiate between those tastes. And as well as with this nerve, you can also have them take a sip of water and also feel for make sure that everything is midline with the trachea, and feel for the movement of that thyroid gland there. Okay. And for the cranial nerve number 8. No. For cranial nerve number 10 is the vagus nerve. We're going to be looking at the gag reflex and having the patient say ah. Okay. And we're going to looking for upward movement of the palate, and we're also going to be looking for contraction of the pharyngeal muscles, okay, as well as checking the gag reflex with the tongue blade. But we're not going to do this now because the patient does not want me to. My subject does not want me to do that. So and stop moving like that, please. For cranial nerve number 11, we're checking the spinal accessory muscles. And basically we're just looking at making sure that the scapula is nice and symmetrical, and just different movements with the patient, arms above their head, and everything to make sure that that's all together. Okay. Cranial nerve number 12 is the hypoglossal nerve, and we're just looking for movement of the tongue. You can stick your tongue out, move it side to side, and just making sure that that's together. You can stop that. And next we're going to look at the cerebellar and proprioception. I'm going to have you put your hands on your legs and just pat your legs, and okay, and we're just looking for coordination. Okay, and you can do that same with the bottom. We're going to have the heel to the shin. Good. And we're going to do that for both legs. Okay, and that's just looking for fine motor coordination and everything. Next, we're going to look at the Romberg test. And you can just stand up right where you're at. And we're just making sure that we're, looking at balance, making sure the patient's not falling over. And we also do that with the eyes closed as well. It's always good to stand next to the patient at this type of test. You can sit down for me. Okay? And that's the Romberg test. The next test that we're going to do is going to be the test for primary senses, and that's when we're testing for on the lower leg, the arms, and the abdomen for sense of pain and sense of if they're if it's soft or if it's sharp, and where if they're able to differentiate where it is on their body that I'm touching them. And the next thing that we're going to look at is the vibratory response, and I'm just going to have you close your eyes and let me know where you feel that.
My toe.
Okay. And
My chest.
okay. And that's the vibratory response. And then next we're going to look at vibratory response and we're gonna take a look at the 2-point senses and have the patient differentiate between the if there's 2 points or 1 point on their skin. Okay. And we're also going to take a look at their tendon reflexes. Okay. Deep tendon. We're gonna look at the biceps. Okay. You can relax your arm. Okay. And then we're going to look at the brachioradialis. Okay. And then the tricep. Relax your arm. Relax your arm. All right. And then we're going to look at the patellar. Okay. And the Achilles. Okay. And then check for clonus here. And I'm also going to look at this plantar reflex. All right. And you don't want the Bambinski reflex. You want it to be a flexion reflex, which was nice and flexed. That's good. So, and that is going to be the end of my assessment. Thank you.